Hi, my name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face to Facts, we're going to answer one of your questions, which are what are the different types of brow lifts? Now, there are a whole bunch of different kinds of brow lifts. I generally categorize them into the most common categories, although you'll hear all kinds of cutesy little fun names for all of them. The first one is what's called a direct brow lift, or possibly even a mid-forehead brow lift. This brow lift literally involves making incisions somewhere in here, either right above the eyebrow or in a forehead crease, and then you excise a small amount of skin to give you the lifted brow effect. This is really powerful for someone who needs a lot of lift or someone who has significant asymmetry, so you need to correct them. Commonly used in facial paralysis patients or trauma patients like that. It can also be used in older patients. Their skin heals really great, and so usually these scars are near invisible, even though it sounds a little bit daunting. The next kind of brow lift is called a trans-blepharoplasty type of brow lift. It means going through the blepharoplasty, which is the eyelid surgery. So going through that incision to do the brow lift. This one is not quite as powerful, but it is nice because you can save an external incision if you're already doing a blepharoplasty. So that incision is usually in your native eyelid crease, and through dissecting all the way up, you can get up to the brow and then kind of pexy it or stick it back up so it's lifted. The next common kind of brow lift is something called a trichophytic or pre-trichial brow lift. Trich basically means hair in medical lingo. So trichophytic or pretrichial means near the hairline. So this one is usually kind of right at the hairline. Sometimes it's a little bit behind, sometimes it's a little bit ahead. But these incisions are also usually camouflaged pretty well, also pretty strong. You can tailor how much you lift on each side, so this is good again if you have pretty significant asymmetry. One of the risks with this one is that there is a possibility that you might have a visible scar. This is also a really good brow lift option if you are trying to lower your hairline, because you will end up advancing the hairline forward or decreasing the height of your forehead as well. The next kind of brow lift is called the coronal or open brow lift. This is the big kind of gold standard style of brow lift, which involves a very big incision going from here to here, and it is in your scalp, and this allows you to access everything in the brow region. So this is kind of what we call like the old school brow lift, because it really lets you do everything with it. You can play with the bone, you can play with muscle, you can play with nerves. It's very powerful in that respect, but you can imagine you're trading it for a very big incision, much longer period of swelling, etc. However, there are definitely still circumstances where you want to use the coronal brow lift. The last category is this kind of endoscopic versus endoscopic style of brow lift. So an endoscope is a type of camera. It's usually about this big-ish or so, and it's a special camera that we use so that way you can get away with using much smaller incisions. You stick this camera through, and then the camera kind of magnifies everything, so that way we can find all the structures. And that's good for you to know, because you'll probably hear the phrase endoscopic whatever lift for a lot of other things in the plastic surgery world, so that's what endoscopic means. And the endoscopic brow lift, or the endoscopic style brow lift, essentially involve making smaller incisions, big visualization, getting your brow lift. So the traditional endoscopic brow lift does involve making a couple of incisions back here, kind of in the brow area, maybe some other incisions right around here, and then you have some incisions here where you are essentially sticking your camera through like this, and then you can go through here and do your little dissection here. You'll see everything from the camera coming in this direction, you do your lift from this direction, pull it back, suspend it back. That's still pretty commonly done. The latest new fad or whatever is doing an endo style brow lift. This one involves still using these same small incisions, but if you can fit in perhaps a very small little lighted retractor, or perhaps you just get enough visualization, you can see everything, then you can actually still achieve that same style lift, except you don't have to use a camera and you still get to use smaller incisions. So that is what I commonly do here, although again, I will try to tailor it to whatever the patient needs. So those are the most common kinds of brow lifts. Feel free to send other questions to us. We're always looking for great topics and ideas that you guys are interested in hearing about. This is today's episode of Face to Facts. My name is Dr. Lexie Wang, and I will see you guys next time.